Hi, I'm Kobe, and I'll be telling you a little bit about anosognosia for hemiplagia, or AHP. Now, the best way to start this off is to break down the term anosognosia, make it a little less intimidating. It breaks into three easy pieces: A, without; noso, disease; and gnosis, knowledge. So it's without disease knowledge, or without knowledge of a disease. Now, this term was initially coined by Dr. Joseph Babinski in 1914. He was a French neurologist, and he was working with patients who had suffered a right hemispheric stroke. He didn't realize that was specifically what had happened, but what he did see were patients that had left side paralysis, and who seemed to be completely unaware of this. In Phantoms in the Brain, Dr. Ramachandran writes about patients with anosognosia as well. The patients he describes insist that they're not paralyzed, but when they're asked to complete a task using the paralyzed limb, they offer some sort of excuse, such as, "My arm hurts right now, I can't do it right now." Or even the extraordinary case where a woman reported that it was her brother's arm and not hers that was there with her, and so she couldn't control it. In the initial cases that Babinski described, patients would ignore such questions, such requests for action, and act as though they had been posed to somebody else in the room at the time. And both doctors report instances in which patients insist that they have complied with the request for action using the paralyzed arm, even though the arm has not moved. Now, both Babinski and Ramachandran also refer to the term exclusively as anosognosia, but in the current research, it's referred to as anosognosia for hemiplagia, AHP, hemiplagia being half paralysis. This condition can be extremely problematic for recovering stroke victims because patients don't account for the fact that they have this paralysis in their rehabilitation. It can also be quite dangerous because they just return to their daily routine, nothing changes, and they may try and take on something that they're no longer capable of. Now, initially, when Babinski coined the term, he accepted the possibility that maybe these patients were faking it. But he didn't find this to be very likely, because if they were doing it to hide this weakness, it was pretty much impossible to do, because no one's going to not notice that you're paralyzed on your left side. He also noted that these patients would have had to continue this hoax for months and months and months on end, which he found completely unlikely. So his alternative was to suggest that it might be right hemispheric lesions from the stroke. We actually do have evidence of this now. There have been fMRI studies which have analyzed patients with AHP, and there are significant right hand lesions. There's also been some speculation that AHP patients are implicitly aware of their disability. They might have some idea of what's going on, even though they can't actively and openly acknowledge it, such as in the case of blind sight, where someone is receiving visual signals but they're just unable to interpret them, so they believe that they are blind, and to their experience they are. However, there is some evidence with AHP to suggest that this isn't the case. People with AHP have been overwhelmingly shown to choose bimanual tasks, or two-handed tasks, over unimanual or single-handed tasks, even when they're physically incapable of performing them and fail repeatedly. Another study had participants attempt a bimanual drawing exercise, so drawing at the same time with both hands. And the participants with AHP made mistakes consistent with someone actually trying to draw with two hands. They were accommodating the movements and confusing the movements of the non-moving left hand with the right hand, which was actually drawing. Now, one promising theory to try and describe what happens in AHP is the intentional feed-forward hypothesis. There's evidence to suggest that when a movement is planned, signals are sent from the basal ganglia and other planning mechanisms to initiate the movement, and those signals go through fine. And in the anticipation of the movement, the parietal lobe becomes active, and a sort of stand-in map for how the body is going to be oriented once this move is completed is put up. And the problem arises when there's no somatosensory signal to essentially cancel this predictive alignment. and report that the movement was unsuccessful. So there's just simply a signal that's missing. There's been one treatment that's been shown to be effective in a number of case studies, specifically that of ED and FG, who were two AHP patients. These two were recorded with their consent completing tasks or attempting to complete tasks using their paralyzed arms. Now, when they were shown the footage by their doctors, they both had a tendency to look away, as if not to acknowledge it, and their attention had to be brought back to the footage. Now, during the showing, doctors were questioning them, asking, what do you see on the screen? What are you doing right now? Are you successful at what you're trying to do? And both patients had a very, very hard time acknowledging it. ED actually ended up breaking down in tears before admitting, yes, I'm paralyzed, I can't do it, I can clearly see myself attempting this action and not being able to do it. As far as further study goes, the sky is really the limit. There are many, many options available. What studies have been done to try and identify the specific causes of AHP have been inconclusive or haven't been reproducible. And these studies have also been restricted to very small sample sizes. As far as treatment, researchers have needed to rely on case studies so far. And again, these results have been fairly inconsistent. There was actually a report of a man who recovered spontaneously from his AHP after a single viewing of these exercises. But again, he's been an anomaly. Which is really part of what makes this topic so interesting. It's not something that can really be effectively simulated. And in the 102 years that we've had a name for it, we still seem pretty far from a satisfying explanation of what exactly is going on in patients with AHP.